Right, we are recording. Thank you, Mr. Carter, for joining us. I'm Erin with Greenbox Solutions. We are a nonprofit that's focused on servicing seniors and their caregivers. We serve the Charlotte area, North Carolina, and several other states. And we wanted to speak with you about Oak Street Health to kind of make people aware of some of the wonderful things you're doing for seniors and their families. So, if you don't mind telling us a bit about yourself and about Oak Street.
Yeah, sure. So, thank you again for having me today. And we definitely appreciate the support and the partnership with Greenbox. You guys have been very instrumental with helping us out, especially with all the PPE supplies we had during this pandemic. You understand that supplies are limited to come by. And, as much as we can do for the communities, it's just, our way of saying thanks. And we appreciate you guys really helping us out with that. So, Oak Street Health. We are doctor's offices for adults on Medicare, just to really keep it, high level there. So primarily 80% of the patient population that we see at our healthcare clinics are 65 and older. We do have a small percentage of patients who are not just 65 yet, but do qualify for Medicare. But that is the patient panel and population that we serve here. We serve the Medicare community. When you think about Oak Street Health, we like to say we're doing healthcare as it should be. We started back in Chicago, I would say roughly 9 years ago, with one location in the Chicago area, and now we've grown to 80 locations in the country. Our clinic here specifically, as it goes in North Carolina, we have clinics in Winston-Salem, Raleigh, Durham, Greensboro, High Point. And here in Charlotte, we have two locations. We have one in West Charlotte in Enderley Park. And then we have my location where I serve as a director in East Charlotte. When you think about Oak Street Health, primarily our motto has been to serve the underserved. Often you see our clinics in communities that have, let's just say, have lack of resources versus other communities. So it may be income based, so on and so forth. So we serve the underserved. And why people really like, Oak Street Health overall is it's a different experience when they come to see us, unlike any others that they had. Our doctor's appointments are longer. We provide, transportation to and from their appointments. And we have other resources that are available to them as well. We have patient relation managers that work with them pre and post visit. So sort of like a concierge to everything that's Medicare. We have behavioral health specialists that work on site. We have social workers that work on site. And we have a lot of providers, medical assistants, and an outstanding growth team that I lead that want to make sure that we take care of, our seniors in our community and overall give them, the best treatment possible, and not just based on, their economic status or maybe, even their race at times. So again, that's a little bit about Oak Street Health, and we've been growing really, really fast.
One of the things I noticed when I visit both of your locations in Charlotte is your clinic is not just medical, if you will. It had a community room.
Correct.
And I think one of them had like a popcorn maker or whatever it is, but it felt like it was more than just like a doctor's office. It was also a community space. So could you talk about some of the community activities you do?
Sure. So all of our clinics have community rooms in them. And obviously, pre-pandemic, these places were a hub for senior social activity. So we've done breakfast and bingo. We've done walking club, gardening club. We may have had, dietitians come in and do, presentations. We've had Medicare presentations. We've had dance classes. We've had, you name it. We just have so much stuff where the seniors can really, come here and like if they had an appointment with the doctor, they didn't have to go back home. They could stay here as long as they wanted to. And like you said, the popcorn machine, the TVs, the music. I mean, it's a center for social activity. So this place was up and running. We were having a lot of fun here before the pandemic. And obviously during the pandemic now we've had to cut back on activities, but we are very optimistic that as the numbers continue to go down, and we continue to see, opportunities to bring our patients back in, especially this spring. We're looking forward to doing reinstituting the walking club program that we had. The seniors really loved that, where we walk in the community, they got their shirts on, they really get, the exercise and all the other cool stuff. But there's a lot of fun stuff that we got planned coming up. Most importantly, what we've done with our community rooms, just to be honest with you, Aaron, is Mecklenburg County has allowed us to start vaccinating our patients here with the COVID vaccine. So we've actually converted our community rooms into vaccination rooms. So we're very excited about the partnership with Mecklenburg County. Already, we have administered 122 vaccinations to our current patients. And then this week coming up, we got another 100 vaccines for 100 new patients. And then at the end of the week, we're going to do the second round for the 122 that we had. So we have found pretty big use for this place, and people love coming in here. But those are just some of the things that we got going on. And this pandemic has just been terrible. It's been awful, and the seniors have been impacted the most, I feel, off of this. So whatever we can do to help them out, we certainly are here to do so.
Now, are you guys accepting new patients, or do you have to be a patient to utilize your support services or get the vaccine or anything like that?
Yep. So to answer your question, yes, we are accepting new patients at this time. So all of our patients, obviously they have to be on Medicare to be eligible to be seen here. So we are accepting new patients. And as it goes to the vaccine right now in phase 1 that we're in, we are only vaccinating, our existing patients and our new patients. So anybody that does come in and they, want to become a patient here and they inform us that they would like to receive the COVID vaccination, we certainly put them on the list to be vaccinated.
And how can potential new patients contact you, your office, or either one of your facilities? How can they get started with the process of becoming a patient?
Well, very good. So I have a team full of outreach executives that work here. So I believe you're familiar with Leslie, working with her. I have Sonia, I have Lisa, and then I have another one joining here pretty soon. But I would say the first start can be with me. My team is our territory managers, and they're not in the often a lot because they're out trying to, spread the good word about the company. So they can particularly reach me, directly at my direct number is 904-885-9582. Or they can reach out clayton.carter@oakstreethealth.com if they are in the East Charlotte area. Over in the West Charlotte location, the best way to reach the director, her name is Takina Garland, and they can email her at takina.garland@oakstreethealth.com. But whether they're in the East or whether in the West, we consider ourselves lucky because we're one Oak Street here. We just so happen to have 2 clinics in the city.
Well, I want to thank you for your time and thank you for sharing about the wonderful things you guys are doing to help the community and to help seniors. And I am looking forward to the community rooms getting back open.
Yeah.
So we can get in there and work together. So thank you so much.
We can't wait to see you again. We miss you over here. So the sooner the better.
All right. You have a wonderful day.
All right. You too now.